So Christine, what is immersive clinical shadowing experience?
No problem. Clinical immersion is actually when educators, students, medical students go and watch clinical procedures. The reason why we do this is it would be nice if your future physicians know what they're doing before they cut you open. And also for our biomedical engineers, these are people who innovate and invent new solutions. It would be great if they actually saw what they are inventing and the space that they are working in. So for instance, for Legree Fitness, those wonderful wellness monitors, those were actually developed by biomedical engineers. And what they did is they went out and they talked to people. They not only talk to people, but they go and they watch. So they watch the fitness clubs. They watch rehabilitation. So what happens after you, say, get a stroke or a spinal cord injury? How do you rehabilitate? How do you get better? And by watching this, we can invent better solutions. So in terms of immersive, what we're doing is we are making this more equitable, meaning can everybody have that opportunity to go and watch a clinical procedure and be able to innovate or invent. And we're doing this through virtual reality by filming clinical procedures in VR so that you can put on a headset and then watch an actual surgery in first person and 360 view.
Now, how does that translate into the medical education itself? So this is something that they would already teach at university and immersive, and it could be like really global at this point, right? And can we do the same thing on like live procedures, or does it have to be pre-taped on a camera?
Yeah, you can definitely do it live. You would just have to be able to stream your 360 camera and your first-person camera together. And like you said, we are trying to do this on a global scale. So Iggy and I just came back from Vietnam to film cataract surgeries. So looking at how we, for instance, solve cataracts here, right? So this is when your eyes degrade. Sorry, when you get older, you're likely going to have it. It's way different than, say, when you're in Vietnam or in a different country. And we want to be able to show these differences and show how they work and what students can learn, like you said, in real time for everybody.
So what does it bring more than just a 2D that I would see on television? So why is it more important to have medical education through a VR set, a goggle set, right?
Great question. So one thing that I've observed is a lot of physicians, their complaints about when their medical students first join them is that they're standing in the wrong spot and they're always in the way. And you hear that a lot, get out of the way. So what we do is by filming this in full 360 view, you can actually see more than what just the physician's doing that you would see in a 2D video. So instead of just where their hands are and how they're, for instance, cutting you open, you can see what the technician's doing to support that. What's the anesthesiologist doing? How are they monitoring that person throughout the procedure? What other types of technicians and procedures are being done to support the entire procedure? Because most people think it's just one hot-shot surgeon doing all the work, but it's really a big mass team of physicians, nurses, and technicians working together.
So how do you see now this translating into a medical metaverse? And are you looking forward to that?
Definitely looking forward to it. I think, again, by bringing stuff like this to the community, we can allow more people to become inventors. We can allow the consumers to give us more input. And we can educate our consumers, i.e. ourselves, in what to expect when we're going to go into a surgery or into a medical procedure. So by allowing this to happen, we can now provide the inventors, the engineers with that direct contact with the people and the things that they're building their devices for. So for instance, I specialize in women's healthcare research. And one of the first things I do that I have my female engineer entrepreneurs do is go out and talk to people and have the people watch the procedures and see what to expect and what are their reactions. So any female ever have a pap smear? Yeah? Anyone not like your pap smear? Yeah. Wouldn't it be great if someone invented a better vaginal speculum to make sure that it's more comfortable? And maybe we can even do it in our own home and give it to the metaverse so we could better screen for cervical cancer.
That's really something. I'd like to understand from, and I think her microphone is now working. Okay, great. I'd like to understand, so you're talking about research now. At one point, where does it stop to be research, and how do you bridge that with corporations and actually making it into real life, products that people can actually now use in the medical field?
We actually, we partner with a lot of hospitals. And so we partner with, for instance, the Children's Hospital of Orange County as well as UCI Medical Center. This has allowed us to be able to give it directly to the medical students who are going to be working on them, as well as the physicians to see what they really need. And then in our own education, I've implemented it as a class. So we do our own biomedical engineering classes and coursework with our undergraduate students, where throughout an entire year, they have to learn how to design, invent, and implement a real healthcare solution.